So good afternoon, sir. This is Karthik Satyamurthy on behalf of HCL. We are welcoming you. Welcome, Mr. Jagannath, sir. And please tell us about your company and what are the different innovations that you are doing for this Corona crisis.
Okay. My name is Jagan. I started this company in 2004. Before that, I worked with General Electric in finance. I am a cost accountant. And in 2016, I started a separate technology company, which is purely focusing on innovations and IoT-based innovations. Something medical devices is one of our main forte. And we have developed, our focus has always been on non-invasive approach, affordable healthcare, and to ensure an IoT-based connectivity with a lot of features and value for the patients and customers. Now, our emphasis and focus is on the wearable technology, which should help in continuous monitoring. With the COVID-19 situation, our wearable technology will be a boon to all the people, mainly to detect the early stage, what do you call the viral load or any of the infections, and then take them to the next level of detection and contact tracing. This is exactly the situation which we are focusing on, and it will be a support to all the people across India. It's a totally an affordable healthcare system.
Yes. Very nice, sir. So thank you for that, and very glad that you're working on that. So tell us something about a smartwatch. What is a smartwatch? And during this Corona crisis, how this can help us in saving a lot of lives?
Yeah, why it is called as a smartwatch is something like, we had started this with focus on diabetes. When the non-invasive glucose monitoring was the first patent which we applied. Along with that, total health monitoring, which also take care of the other parameters like your body temperature, your SpO2, your heart rate, your non-invasive hemoglobin, and with the software to trace the person. Now, in a COVID-19 situation, these two parameters are very, very helpful. One is the body temperature, because today the moment anybody is infected, may or may not be the fever or the body temperature goes up. So this is one parameter which can be monitored continuously. The second one is the SpO2, the oxygen saturation of the patient. So what really happens in a SpO2 is, in a COVID situation, the first thing what is affected is your oxygen level saturation, which falls down to less than 93%. That's what is the technology, the research papers and the medical standards are telling. So it drastically drops down. So along with SpO2 and the body temperature, we will be able to monitor and find out if a person is is infected or not. Along with this, we also, the same sensor what we have can give you the benefit of the heart rate, if it is really, the changes in the heart rate, and also the hemoglobin content. So this can also be monitored with our smartwatch. And the whole technology is based on near infrared, and it is one of the most proven technology in the world, and a lot of research is happening on near infrared. So this can support in terms of integrating, because it's an IoT device, it has a Bluetooth built. It can also be integrated to any of the apps, something like your Arogya Setu app or any other, Karnataka government has got some app which is for tracing, people who are quarantined. So we can integrate with any of these apps. So these are the, so it will truly make the whole system as a smart. And one more thing which we want to emphasize is, we are not selling any device as such. We are selling a complete end-to-end system for monitoring and ensuring that the health is monitored. So that's the objective.
Okay, great, sir. So now we also heard that this can be implemented at an organization level. Tell us something about that and how exactly, in terms of safety, because you're going to, implement at the organization level, a good amount of safety also needs to be considered.
Yeah, the device can, since it's a wearable, it's pretty easy to wear it, and people can use this like a watch. They can have a time sense. Everything can be monitored in that, and it is a Bluetooth which can be connected to your mobile. And we can also, on a back end, we can track we can link this whole thing to the employees, environment, their registration process, everything can be done with that. And in an organization, at the entry level itself, it can be, the person can be monitored and say if they have any of the symptoms of COVID or any other issue, they can be asked to be like temperature and your SpO2 can be monitored. And even staying at the offices, it can be monitored continuously. Now, the good thing about this device is it gives signals, it gives you the readings continuously at a time interval. We have set it at 15 minutes, but it can be set at a 30-minute interval or a 1-hour interval at your convenience and requirement. And if anything within that range, if something is traced, the system will automatically try to do the 2 to 3 times, the system, the reading, and then the result will be flashed to the control center to check whether the person can be sent for further testing. That's how a corporate can be used. And you can also use this for any incoming person who are not your employees. It can be like vendors or anybody. You just ask them to wear the watch and monitor their, whether they have any of these symptoms at all. Maybe until they are inside the office and they come out, you can track them and ensure that the safety of others are maintained. So this is the objective of this smartwatch in a
Okay.
corporate environment.
So you're saying this can be completely customized for a specific environment, right? For an organization, and
Absolutely.
you can help us to do
We
that
can
in the.
define and we can do a backend, anything that is required.
Okay.
It can be compared, it can be put from machine to machine language. So that's how it works on
Okay.
the principle. Yeah.
Okay. So what are the disadvantages of the smartwatch? We heard about the advantages. What are the disadvantages?
Disadvantages could be the people have to wear the watch. That's all. Because this is, if they don't wear, then you will not be able to get the signals. To ensure that there is a button to on it, and if, say for example, if they have left it open, I mean they've just on the system and then left it as it is without wearing, then it will give you normally a false readings. So to avoid that, what we have also triggered one more parameter. There is a green LED which is there built in. So it will detect the skin parameters. If somebody is wearing only, it will be, if the parameters are set to standards for a green LED, which will detect and say that, somebody is wearing or not based on the skin. So this is also which we have, over the period of research, we have ensured that this is, this is one parameter which is really required.
Okay. Fine, sir. And how about the data privacy issues, and what is the cost of the product that we are actually looking at?
Yeah, we will be going with the cloud because the whole system is put on cloud, and from our data privacy perspective, we will have to take some of the consultants' views. But for all practical purposes, since we will be going with some of the cloud like Microsoft Azure or the Google thing, they are also approached us. They have approached us. or the Amazon thing. So
Hmm.
we will go by, we presume and we are quite confident that they have maintained all their, the privacy issues.
Hmm.
And we will adhere to those standards. And also some of the consultants will give an approval for the thing. One good feature I would like to point out is this is the data is in the control of the user. It is not something which we are trying to
Hmm.
flash it on a public, and nobody owns that. It will
Hmm.
be owned by the patient alone and
Hmm.
the organization which they are working. It's not beyond that. No other agencies will be owning this particular data. So
Okay,
that's
that's
the
very good. That's a very
thing.
good news. Yeah. And also, what is the cost of the product, and how scalable is it? Because if you're looking at a lot of things coming in, how soon or how what is the scalability? We want to understand how soon or you can scale it.
Okay. So as far as scalability is concerned, see, we can, once we sign an agreement, we can immediately do, because the board's design, the software, everything is ready. All that we have to do is to get an
Procure the
objective
items. Hmm.
clearance from your, the way you want your, the staff would like to see the device. If they want a different mechanical design, we can design it and give it to you. Absolutely no, we can customize it to your requirement. The brand name what we are using, our product is known as a Swast smartwatch. Now, if you want to add to your employees, we can also customize to that level. Now we also have, in terms of a scalability production and all, we right now we are using the outside third-party manufacturing companies for, because it's more of electronic. You get
Correct.
all the boards assembled in less than 1 or 2 days, and then just dump the codes and give it to you, do a testing, and then give it to you. That's all. The only time that will be consuming is for making it aesthetic to you, because whatever we have done right now is a trial product, and there is also a little bit of lead time for the components to be imported. So that depends on the volume that we are asking. We can speed it up. It normally takes around 15 to 20 days for the product to come, and by the time we can keep other mechanical designs and other things which is approved by you for your employees, and then we can put it in practice. We can also give you a test kit, maybe around 5 or 10 devices for the user feeling, and to upgrade the software or the backend operation to suit to your requirement. So that can also be taken. So user preferences and their comfort level can also be taken care. Now your question with regard to the your side effects, there is absolutely, this is a near infrared technology. We are not using any SIM card, and it is not interfering with the mobile. So there is no effect of radiation. So the only impact could be, people when they normally wear for a continuous period, there could be some sort of a sweating, which can be, at that time they just have to remove the watch and try to wipe out the whole this thing. That's all. Otherwise, there is no disadvantage from this particular system at all in the this thing.
Okay.
Yeah. Any other?
So what are the feature possibilities, that you are actually seeing, in terms of enhancements? Is that something, are you
Right.
planning to integrate with Arogya Setu app or something like that?
Yeah, so we are also trying to talk to the Arogya Setu. Once we put it on the practice, there is an advanced level of discussion which is happening with them. As far as the integration is, I mean, enhancement is concerned, we can give diabetes monitoring for this, because the sensors, the software is designed for glucose monitoring. And second thing is that for that, we are in the final stages of the clinical trials. So we will try to complete that in the next 2 months, and we can enhance it with the diabetes monitoring. This also has, we can also enhance to do a ECG monitoring with this, which can be a pulse-based ECG, and also you can track your what do you call a blood pressure on without non-invasive and without a cuff. So all these are patented product. Everything we have taken a patent in the health monitoring, and this can be enhanced for the suitable requirement of the patient. Along with this, we also have other products which are going to monitor the health of a person. Things like your 12-lead ECG, integrated blood pressure monitor, and also a digital stethoscope, all in one we have already designed. We have also made a ventilator which can be kept in your corporate on immediate emergency use. These are all affordable healthcare, and it should be, we can enhance, all will can be upgraded to the one single system. All of them are working on a Bluetooth and a Wi-Fi enabled system. So you can get all the reports, results, everything which can help the employees' well-being, and also all the people who are associated with you, maybe your vendors or your suppliers or any of these people. That's it.
Fantastic, sir. Thank you very much for actually spending time with us, sir. And this is going to be very valuable information, because this is going to give us a skeleton about how exactly a smart watch can actually change each and everybody's life actually. And I think one part that we missed out is the cost of the product, sir. Is that what is the cost when you're having it, and when you're buying as a single one? And as the cost, I know as the cost goes up, I mean, as the product, the scale goes up, the cost could be brought down. So I'm just wanted to understand, what is the current product cost actually?
Yeah, the POC cost for the only the COVID thing, like your features, like your SpO2, temperature, hemoglobin, and heart rate, is roughly around 3,000 rupees is what we have now. And if we try to add the glucose sensors, it will cost you another 1,500 rupees more. And there is also, we can also monitor the step counts. Any of the features you don't want, the cost can come down. That's the main thing. And it also has a rechargeable battery, lithium-ion battery, which is, you can just normal, like a mobile phone, you can charge it anytime. So there is no additional cost. So one good feature of this whole thing is you don't have any OPEX cost at all. You just, you have only a capital cost. So at any point of time, any issue coming up, we will be supporting, we'll just replace it, and then we can take care of the whole system. So you are benefited, your employees are benefited in terms of just using it like a watch, except for the battery. If it is maybe normally a 1 year or 2 years is the normal warranty time for a battery, only that time they have to replace it. Otherwise, you have a cost-free support value mechanism for all of your people.
Okay.
That's the idea.
This is a prototype of the device.
Okay.
And I am wearing it like a watch.
Okay.
Now I put it on, so
okay.
I'll be able to show you. Only thing is, I'll do one thing. Just
remove it.
Hold on.
Yeah,
I'll put
remove
it on
it.
yeah, I'll show you. This is the device, how it looks. Now I put it on. The Swasth name is coming. After that, it starts showing up the time.
Okay.
Now, each reading, what it takes of an individual has been numbered. And each device now currently, because of the operational aspects, we have given a name of the individual on whom it is trying. These are all customizable. Isn't it? So there, it gives you the temperature. Now, these are all temperatures which are non-calibrated. So the device is still under the calibration stage. So that's why it may not be completely correct. Now it is giving the ADC readings, which it uses for the calibration.
So since he's not wearing it,
it may not, because the results, since I'm not wearing it and it is not reading my hand.
That's fine. So we are looking from a demo point of view, how exactly it will.
Fair enough. Fair enough. Yeah, yeah.
And also, for example, if somebody has gone out and has coming inside, right? Normally their temperature variation could be there because of the sun, in the afternoon and other
Yes.
stuff. And during that time, how exactly it works?
Yeah, it works exactly to your, see, only thing
It'll
they're coming from the sun, they have to just wipe out the hand because there could be a feeling of a sweat. Your sweat will increase the this thing, so they just have to do it. And normally what we do, if there is if it is exceeding, say 100 degrees or something, we don't go by one single reading. We try to take it as per WHO standards. We take at least 3 to 4 readings and then only compare it.
Okay.
It's the way it will be taken care. It's
Okay.
not a single reading which gets into this.
So technically, you're saying when we are going to use this watch, so the moment they start seeing their oxygen level coming through, I mean coming down, that is SpO2 in technical terms, right? So
Right.
immediately alert can be sent, and this
Yes.
Yes.
alert can help us to isolate the person who could be a high risk potential with the others, right? That's what the whole concept is.
Yeah.
That's
This is
yeah.
the heart rate, Mr. Karthik. It's showing.
Okay, sure, sure.
Yeah.
Very nice.
The results are shown.
Okay. So SpO2 also will come in the
Now,
same way. Yeah.
now all this data has been saved to the SD card which is there in it.
Okay.
Now this, as Mr. Jagan said, it can be transmitted through a Bluetooth, it can be transmitted through a IoT, or we can through the USB port, we can take it from the SD card for a system or your central company system or anything.
Okay. Great. Thank you so much, Ramesh sir, for giving the demo.
Oh,
Yeah.
it's my job. Chalo, chalo.
Okay. So I'm just stopping.